Well, welcome back to Oracle TV. I get to sit down here with Lynnette Clinton, CIO of BayCare Health System. Lynnette, thank you so much for spending time with me again.
Thanks, Sean. I'm really happy to be here.
Well, I'm always excited to talk with you. And this time, talk about, from virtual nursing to AI and the whole person care. I mean, you have an exciting future ahead, the work you're doing now, and also what's coming next. So let's dive in right away and let's talk actually just about BayCare.
Sure.
Tell me about your mission, about your work.
Right. So BayCare is the largest academic health system in West Central Florida in the Tampa Bay area. We have almost 33,000 team members, and we are at 16 hospitals, hundreds of ambulatory clinics, and we are passionate about taking care of our community. It's what we think about. It's our driver. It's making sure that we're always doing right by the patient, and everything we do, even everything we do with Oracle, is with the patient first mindset.
I love that you said passionate about it, and I believe you when you said it. And thank you for that work. And when you think about your mission and your work, what barriers get in your way of delivering that mission and that care?
Right. So for so many years, we have what I like to say is that we give our clinicians and our physicians what they need, not what they want. So we've given them tools to accomplish their regulatory requirements and their documentation and all these other things, but we've not made it easy over the years. We have too many tools, we have too much computer time in front of these providers, and we need to give them some help, some relief.
So you identified some of those challenges. So then how have you begun to address them?
We are fully embraced. What a time to be a CIO, by the way.
Absolutely.
We are in a revolutionary time.
Yes.
And I am honored to be here at this time. I'm excited. I think, we have this, it's a time where we are, I like to say that, this is it's like 1996 when the internet was coming out and every company was getting an internet website. This is where we are right now with AI, with conversational and generative AI. AI has been around for 70 years, but generative AI is fresh for us. And we're taking a multi-pronged approach. We are, of course, BayCare takes security at the forefront. So we're cautiously, securely evaluating everything. So everything that we can infuse into every process, from the revenue cycle, the front end, from our physicians and into our nurses now. We are infusing new technology and AI everywhere we can.
Yeah,
to help.
Absolutely. And you're right. We're in a technology evolution that we've never experienced before. And It is exciting. I love that picture you painted of what it's like to receive that first wave of internet, but now it's very different.
Right.
What we're going to receive and what we can do with that.
Yeah, this is a once or twice in a career style of moment right now.
It's absolutely. We could talk about that for a while. But, when you think about that, what is the role that Oracle Health plays in this for you all?
So Oracle is listening. They're listening to us. We've taken a measured approach to say, who our partners should be. And we know that we have a good partnership with Oracle now. And we always did with Cerner in the past. And there was a transition time we were concerned, how is this going to go? What are we going to do? And we are sure now that we are on the right path. So we are, we're thankful for our partnership with Oracle. We are happy that we get to beta as many products as we do, because it's a lot of work on our team, right? It really is. And they work so hard to make sure these products are valuable for all the customers. But what that gives us, it's selfish. We get to give what we think is the right thing to do right from the beginning, and we get an early product. So it's beneficial for us. It's still a lot of work, but we also know that, the more clients that Oracle can have on their products, the better all of our products will be. We know that.
Absolutely. Absolutely. And by the way, we're thankful for you too. So thank you for being thankful for us, but we are thankful for you as well. And, can you talk about specifically our role when it comes to the clinical AI agent for nursing.
Sure.
Yes.
We are thrilled. Obviously, and many people know, and Stephanie spoke this morning. Stephanie, our CEO, is a nurse by trade. So it's at her core. Of course, it makes BayCare, it's a perfect match for BayCare because BayCare is a caring, compassionate organization at its core. And being a nurse, Stephanie is as well. That's her core. So to bring this advanced technology to nursing is a dream for her. And we're excited to deliver it for our nurses. So we've partnered with Oracle. We know other customers like us have fed into the build of this tool, but we're the first in the world to pilot it with Oracle. And we are so proud of that.
Yes, I love that. And, specifically the clinical AI agent for nursing. I mean, I think someone said, I was talking to someone and they mentioned that they said this comment of it's the year of the nurse. And I'm like, let's claim that.
Yeah.
It's the year of the nurse.
Can we copy that?
Yes.
That's
yes,
great.
you can. It's the year.
I love it.
It's the year of the nurse. So have you heard any feedback?
Yes. So just like any other tool, the first version of it is early, right? It's a little basic. It's mostly used right now by our patient care techs. They love it. I actually have a couple quotes if I can read them.
Yes.
So our patient care techs say, I don't have the opportunity to forget charting since I'm doing it real time as I complete a task, right? The second quote, real quick. It's so easy to ask Oracle to document on a patient without having to navigate through the EMR to the charting window. This saves me time. So that's direct from our patient care. I actually brought those quotes. So 2 of our patient care techs that are actively using it right now. The nurses use it too, but they're really excited about the next step, which we don't get disappointed about an early version. We're excited. We know that there's so much that goes into being the first. And the first version that's released tests so many things other than the functionality. Make sure you can log in okay, and that, the app works on your phone and all these things. And our nurses use it a little bit, but they're really waiting for those patient care summaries. They're dying for that functionality. So we know the next release is going to have more users and it's going to be even better.
Wow. So I love that. And you can coin that phrase, by the way.
Okay.
And, to wrap up, we're reshaping, we're reimagining care. We're on an evolution of healthcare. We're in a new era of AI. Why is Oracle Health and Life Sciences, the right partner for you on this journey?
Right. I would say they're listening. Oracle is listening. They have invested in partnerships. They're showing they care. Oracle, you all are showing that you care. And you're bringing the most advanced tools of anyone in this industry. So there's nobody else. I do believe there's nobody else that can do what you're doing right now so quickly on an AI first platform. And we are thrilled to be on it.
Wow. Well, Lynnette, I could sit here and talk to you forever because I feel like we could just feed off each other's energy. And we have claimed that it's the year of the nurse. But it has been wonderful to talk with you about what's happening now and also what's happening next. AI is in action, and there is so much excitement for the future. So thank you so much. And thank you to all of you for continuing to tune in to Oracle TV. And we're going to take a quick break, and we'll be back.